Most of my work is in behavioral health, so substance use and mental health treatment for people who are coming to the United States with refugee status. So by definition, they have had experience with trauma, but they're also coming to the United States where they face all kinds of barriers. I do research that is community-based participatory action research. I really base my research projects in what the community wants, their ideas and definitions of problems, and then it's also action-based, meaning the findings from my research need to have actionable outcomes that are immediately relevant and visible to the communities that are participating in the research. Karen people are an ethnic minority group in Burma that have been experiencing widespread and long-standing human rights abuses. And St. Paul happens to have one of the biggest Karen communities in the United States. One project that I worked on was related to translation and interpretation for medical and psychological and substance use appointments. So in the Karen language, there isn't always a one-to-one translation for a lot of English words. For example, a doctor might say, "Can you tell me about your heart problems?" to a Karen patient. And the Karen patient is thinking, well, in my culture, heart problems are emotional problems. And so I'm going to talk about my emotions, but I'm not going to talk about the heart palpitations that I have. And so we created a Karen English glossary for medical and psychotherapy and substance use appointments. And then we trained the majority of Karen interpreters in the Twin Cities to be able to use that glossary and that language in their interpretation appointments. One of the unique things that came out of that process, though, was just how much knowledge and wisdom interpreters have about how to best treat a Karen patient. And so now we're working on another research project that's related to how do we get interpreters more power in the interpreter-provider-client triad so that they can do things like cultural liaison and anything that I can do in my research to restore power to communities that have had that power stripped away. That's the sole motivating factor for the work that I do.